Thank you for taking a few minutes to learn more about fetal alcohol spectrum disorders, or FASD. Educators can play a critical role in determining whether children with FASD reach their maximum potential, but first we need to know what it is. FASD is not a diagnosis, but it is an umbrella term describing the range of effects that can occur when a developing baby is prenatally exposed to alcohol. These effects may include physical, mental, behavioral, and/or learning disabilities with possible lifelong implications. There are many terms under the FASD umbrella, including these medical diagnoses: fetal alcohol syndrome, alcohol-related neurodevelopmental disorders, alcohol-related birth defects, or partial fetal alcohol syndrome. FASD is a lifetime disability that affects each child differently. Some children with an FASD have specific facial features and tend to be smaller in height and weight. They often have a brain injury that never goes away. This means both the child's thought process and behaviors may be very different than a child who was not prenatally exposed to alcohol. The brain damage is the most challenging part of this disability. FASD is the leading cause of developmental disabilities in the U.S. Recent research shows the rates of fetal alcohol syndrome and FASD are higher than previously thought. In Minnesota, 7,061 babies are born each year with prenatal alcohol exposure. For some groups, prevalence of FAS is estimated to be 6 to 9 per 1,000 children. Previous estimates were 0.5 to 1.5 per 1,000. For some groups, prevalence of FASD is estimated to be 2 to 4% or 24 to 48 per 1,000 children, whereas previous estimates were 10 per 1,000 or just 1%. Alcohol use during pregnancy is the leading known cause of developmental disability and birth defects in the United States. FASD affects an estimated 40,000 infants each year, more than spina bifida, Down syndrome, and cerebral palsy combined. Without an understanding of the physical, behavioral, and cognitive challenges faced by people with FASD, typical misbehaviors can be misinterpreted as willful misconduct or deliberate disobedience, when it is often just the opposite. Due to the brain damage caused by prenatal alcohol exposure, people with an FASD have difficulty with the following: input or taking in information, integration of new information with previous learning, output or ability to use information. Individuals prenatally exposed to alcohol have difficulty with abstract reasoning. The concepts are often meaningless as the brain is unable to process that concept. They have difficulty with cause and effect reasoning. Consequences often don't shape future behavior. Past experiences and related consequences are not recalled at the point of engaging in similar behavior, which is often impulsive. They have difficulty with generalization. What's understood or done in one setting does not automatically transfer to other similar settings. When you change a piece of the routine for the individual, you have created an entirely new routine. They have difficulty with time, telling time, feeling the passage of time, associating specific activities to numbers on a clock, and cyclical nature of events. They have difficulty with memory, especially working memory. Their visual memory is often better, so we can show them rather than tell them and use fewer words. They have difficulty with behavior, peer problems due to immaturity, emotional or behavioral outbursts due to frustration or being misunderstood, and they have difficulty with adaptive functioning. Independent living skills are delayed or often never fully developed. FASD is a lifelong disability, but often secondary characteristics occur, which are the result of living with the struggles of the primary disability, such as fatigue, tantrums, irritability, anger, fear, withdrawal, shutdown, trouble at home, school, legal trouble, drug or alcohol abuse, mental health problems. Caregivers should adjust their expectations of the person with an FASD to the developmental stage they are at in that moment. Expect variability. Some days they may seem to function well, and other days they will have frequent struggles. This is typical, but not intentional. Provide additional support when they become overwhelmed. Learn to read the behaviors and intervene earlier. With most kids with an FASD, we should cut their age in half, and that's often the age they are functioning in most areas. Imagine sending a 9-year-old into the real world with little to no support. Behaviors demonstrated by students with FASD are commonly misinterpreted as shown here. While there's no recommended cookbook approach to working with individuals with FASD, there are strategies that work based on the following guidelines. Be concrete. Individuals with FASD do well when people talk in concrete terms. Don't use words with double meanings or idioms. Be consistent. Because of the difficulty individuals with FASD experience trying to generalize learning from one situation to another, they do best in an environment with few changes. This includes language. For example, teachers and parents can coordinate with each other to use the same words for key phases and oral directions. Use repetition. Individuals with FASD have chronic short-term memory problems. They forget things they want to remember as well as information that has been learned and retained for a period of time. In order for something to make it to long-term memory, it may simply need to be retaught and retaught. Have a routine. Stable routines that don't change from day to day will make it easier for individuals with FASD to know what to expect next and decrease their anxiety, enabling them to learn. Keep it simple. Individuals with FASD are easily overstimulated, leading to shutdown, at which point no more information can be assimilated. Therefore, a simple environment is the foundation for an effective school program. Be specific. Say exactly what you mean. Remember that individuals with FASD have difficulty with abstractions, generalization, and not being able to fill in the blanks when given a direction. Tell them step by step what to do, developing appropriate habit patterns. Have structure. It's the glue that makes the world make sense for an individual with FASD. If this glue is taken away, the wall falls down. An individual with an FASD achieves and is successful because their world provides the appropriate structure as a permanent foundation. And use supervision. Because of their cognitive challenges, individuals with FASD bring a naivety to daily life situations. They need constant supervision, as with much younger children, to develop habit patterns of appropriate behavior. When a situation with an individual with FASD is confusing and the intervention is not working, then you should stop the action, observe, listen carefully to find out where the child is stuck, ask what is hard, what would help, be patient. Children with an FASD can tell you a rule, but that does not mean they can always follow it, which is very frustrating. Reteach everything. Don't get irritable or short-tempered when you have to teach your child the same things over and over again. Sooner or later, likely later, they will get it. Break all tasks down to one step at a time. Children with an FASD can't always see the parts of a whole, nor can they always understand a sequence. Help them to see the parts in the order of an activity or task. And create some fun in every day. FASD symptoms can create a lot of tension and stress in the family, so make sure you find something positive and fun in each day. It can be simple and short, but it needs to happen. Individuals with FASD have a range of overlapping or secondary disabilities that the individual is not born with and which could be improved with appropriate interventions. So keep that in mind as you're working with students as well. If you'd like to hear from people with FASD and what they have experienced, there's some great videos at this link that you could watch that gave some great perspective on what their experiences have been. The most important thing to remember when teaching a student with an FASD is that the student has the capability to learn. Educators must work hard to find a way to assist the student with an FASD in discovering what helps him or her to learn and to enjoy the learning process. Educators must assist students with an FASD in becoming prepared for living the rest of their lives and working to their potential. Here are some more resources for further research or ideas on how to work with students with FASD. I hope you took some tips from this presentation to better support your students.